So I am Dr. S.K.S. Marya. I am an orthopedic surgeon and have been practicing this specialty for close to 40 years. As people grow older, the neuromuscular coordination gets weaker, and in addition, they have to be very careful about the environment around them. If there is any imbalance either in their neuromuscular coordination, or say there is a slippery floor, there is a sudden step which they haven't observed, they're likely to fall, and it's all too common happening in the elderly, and more so as they grow older and they have less lighting in the house, less support in the house. So these things are very common now. Well, if somebody falls in your family, the first thing is to immediately give them confidence that they're going to be helped. The elderly get very insecure immediately. Next thing is to support the part which is bothering, or if there is a change in shape. Suppose there is an injury to the arm and it is looking very twisted, very gently bring it close to its normal shape. Third thing is to call people around you and ask, define that you do this, one of you get in touch with the hospital, the other one brings some support depending where the injury is, the other one, these are the usual things which we do. Hopefully many times they have not sustained very serious injuries, and in these cases the patient should then be made comfortable. If they can walk comfortably and they can talk comfortably, but kept under observation, and for a few hours not given anything to eat, just in case medical attention is required. So yes, these patients need moral support, physical support, and then of course medical attention depending on the kind of injury. Well, most important is immediately the patient can't move a part. Most commonly the patient can't move the hip, cannot get up or stand. Next thing is has severe back pain. The next thing is, which is even more dangerous, is cannot move the limbs at all, which means there are some nerves being pressed. Of course, when there is an injury to the wrist, which is the most common, then it's very obvious and you need to support it. So, and after a few hours, if everything else is fine, patient has fallen, look out if there are any obvious signs of anything happening to the forehead or the head, any bumps coming up anywhere. And the most crucial thing is to be aware that the patient doesn't start losing consciousness, and that scares us because something is happening in the closed compartment of the skull bone. So those are the flags one has to be very careful about. On the other hand, if there has been an injury which requires some kind of medical intervention, depending on the type of injury, quite often you recover a lot, but there are situations where recovery is extremely slow, and it can most importantly take the confidence away, and the patient should not get into a feeling that this is the end. Now that is the most dangerous thing. You will hear from elderly patients, now I have had enough. Now once the patient gives up mentally or psychologically, no amount of medical treatment can cure the patient. Having said that, there's always hope and recovery can happen. Yes, I mean, most important thing is depending on the amount of instability. If it's a normal person, maybe 70, 80 or more, otherwise healthy, doing everything normally, then there are a few things like anti-slip mats, anti-slip tiles in the toilet, grab bars to hold wherever there is some kind of insecurity, or even when they get up from the WC, etc. You should be careful with the pets in the house, what kind of pets you have. Careful with the carpets that they don't fold. Very common to actually stick your foot in the carpet and fall down. Now this is as the healthy people. Those who are otherwise not very firm on their feet, for them it is important to have some support to walk. The least you can have is a stick. Not only does the stick give you some support, but every time you put the stick down, you see what is next on the floor, and you're not walking intuitively that all is fine, I'll reach there. So with that, you prevent any tripping.
Age Easy by Antara, empowering seniors to age with ease and joy.